call, dear participants, you are all welcome. If you have any question, you can ask me after my presentation. My title is Enhanced External Counterpulsation Treatment in Patients in Refractory Angina Pectoris, ECP or ECP, a treatment method used in heart failure and coronary artery disease, is an evidence-based alternative non-invasive treatment. In addition, patients show good compliance with ECP. In this treatment carried out by a professional team, a cardiologist, a trained and experienced nurse, and an assistant physician are included. The ECP device used in the treatment consists of a control console, a patient treatment table, an air compressor, and 3 sets of cuffs. The cuffs are wrapped around the lower leg, upper leg, and hip areas. During the treatment, the systolic and diastolic pressure waves of the patient who are connected to the electrocardiogram are followed by the finger probe. You can see the picture. The cuffs are inflated sequentially during diastole by filling with air through the microprocessor and computer in the system. Thus, it increases the blood flow to the heart and provides oxygenation of the heart muscle. During systole, the cuffs descend simultaneously, reducing the preload of the heart. This reduces the preload of the heart. ECP is the safe and probably most appropriate treatment modality, especially for patients presenting with symptomatic coronary artery disease who are not amenable to further revascularization. A result of the literature review, it has been revealed that ECP consistently reduces angina pectoris and extends the time until exercise-induced ischemia. In addition, it is reported that it depends on nitroglycerin use for frequent chest pain decrease and the quality of life increase in symptomatic patients with stable angina. Patients with refractory angina pectoris experience recurrent symptoms despite receiving medical treatment. These reduce their functional capacity, which consists of psychological distress and health-related quality of life. Symptoms seen in these patients due to ECP treatment decrease, their physical capacity levels increase, and their cardiac anxiety decrease. According to the physical activity levels and life satisfaction of the patients increase. The review literature also reported a small number of adverse events related to ECP. For example, pressure sore, blood, ecchymosis, abrasion due to pressure or friction, headache, dizziness, tiredness, back pain, muscle pain. Although ECP seems to be a safe and well-tolerated treatment option in patients with refractory angina, nurses need to be careful and flexible to prevent adverse events and terminate treatment early. Thank you for listening. This photo belongs to Tarsus waterfall. You can see. Thank you for listening.